Good afternoon, everyone. Welcome to the November Health Equity Jam session. It's good to see all of you. I'm Dr. Lisa Cooper, and I'm just going to say a few words and then turn over to our host for this afternoon. I'm just excited because we have two speakers today who work very closely with me at the Johns Hopkins Urban Health Institute. And they are doctors Vanya Jones and Sadiya Muqueeth, and they are associate directors at the Urban Health Institute here in Baltimore. They're going to tell you about the exciting work that they've been doing there with us and our team. But before all of that, I'm going to turn over to our host for today, Dr. Deidre Cruz, who is Deputy Director for the Johns Hopkins Center for Health Equity, because we have to have our special Johns Hopkins Center for Health Equity welcome. So here we go over to Dr. Cruz.
Thank you very, very much, Dr. Cooper. I'm really excited to be with you all today and to welcome our speakers for today. We're going to start off with our kind of traditional way of doing things at our jam sessions, which is to share with you some of the fun facts of the speakers that we have today. And we like to do it kind of game style. We like for people to get to try their hand at actually guessing what some of the answers are for our speakers. And so I'm going to start, as you heard, we have two speakers today. So I'm going to start with some of the fun facts of Dr. Vanya Jones. So we're going to do a couple. So let's go with this one. So Dr. Jones has visited a number of continents. You all in the chat want to guess which continents she's visited? And Dr. Jones, we'll give you a chance here in a second to tell them which ones they got correct. Okay, I see one vote for all of them. Okay. All right. Some people think you've been to all of them.
My goal is all of them. I will tell you, I have not been to all of them. There are two left. I've been to five. I have two to go. Antarctica obviously is a hard one. And so I have not been to Antarctica. I'll tell you the ones I've not been to since there's only two. And I have not been to Asia. That surprises people. That's the one. I know. Every time I get a trip planned to Asia,
come visit.
It gets canceled. So Asia is high on the list. So I've been to Australia, I've been to South America, I've been to Africa. Obviously, I've been to North America, friends. Yeah, I've been to Europe. So the two that are left are Antarctica and Asia.
Well, very good. So it sounds like you're presently taking invitations for a trip to Asia, maybe Antarctica. I've heard great things about. I've had a few friends who've gone on to Antarctica and I've actually had a really great time. So keep that on the list. So we'll keep that. So the other fun fact that Dr. Jones shared was that she enjoys a certain type of dancing. So I want to invite you all in the chat to try guessing which type of dancing she likes. Wow, lots of votes for the same type. Okay, tango's coming in. Samba.
I feel like
let's give him a sec. Yeah. Let's give him a sec before.
Yeah.
Flamenco. Okay. Ballet. All right.
Wish.
These are good. Well, the first three respondents were correct. Do you want to tell us?
Yeah. So I feel like if you've been in the Baltimore salsa scene, there may be a moment where you're on the dance floor and turn around and you see one Vanya Jones. When I was a PhD student here, there used to be an instructor that would come to this campus and teach salsa lessons. So this is in the back before days. And I wound up taking salsa lessons with her and then discovered the Salsa Network in Baltimore. So don't be surprised if you're at a salsa club in Baltimore and you turn around and see one Vanya Jones.
Very cool. I've actually took lessons there many years ago. It may have been before you were you were you were there, but that's great. So now we're going to turn to Dr. Muqueeth and look at her fun facts. So one of them, and just to sort of set this up, so lots of people like to sort of form clubs to bring together a group of like-minded people. Sometimes, bringing together friends, sometimes even bringing together people they don't know. What thing do you think Dr. Muqueeth organized a club around? Books, food, more food, health, equity, arts. Oh, more votes for food. Comic books, specifically.
Ooh,
I like it.
interesting. Yeah, I was just talking about the X-Men earlier today. Travel.
Travel,
Ooh, I could see
perhaps to
that.
go to Asia and Antarctica.
Right,
Right.
Very
right.
good. Okay, music.
All right, I can share a little bit.
Yeah, please.
So back when I was living in Atlanta, I was a fellow at the CDC. And during my fellowship, I had friends over at Emory and I had friends over at the CDC. And then I had friends over at like some of the nonprofits, major nonprofits in the area. And so I felt like this like massive community needed to come together and know each other. So I started a food club. Good job for like
Yeah.
7 of the 10 people on this. Um, and the food club was basically I would pick a restaurant. You had 10 people who could sign up. You had to bring a stranger so that folks could get to know each other more. And we did it for like more than a year and people really enjoyed it. So I love small ways to bring community together in big, large cities.
Very cool. That's awesome. Well, I think everyone's hoping that you'll set up one for here in Baltimore too. So good. And then another fun fact that Dr. Muqueeth shared. So um, lots of folks in the public health and the health equity space have talents around communication, and I'm wondering if folks want to guess how Dr. Muqueeth may have sort of displayed or shared that talent in her past. That's a good one. Hosting, dining. Okay, getting warm. I think this might have been it may have been a harder one, maybe based on how I set it up. But do you want to share?
So, who the person who said public speaking was semi-close. I will just say, so I was a Peace Corps volunteer in rural Paraguay. So like 30 kilometers, dirt road, down a path. But one of the things that we did have was a radio station. And so I had my own radio show with my other Peace Corps volunteer friend who lived in the community over. And so we
Okay.
had, I played Bhangra music, which is like a Indian dance music. We gave, out information because the other volunteer was did work around beekeeping and farming. So we did work education around that. I would do health chats, thinking about like promoting immunization and things like that. So lots of fun things. I do have to say, I get the giggles very frequently when I am on when I was on the radio show. So some of the community members started being like, "Oh, you're the girl that laughs." I don't know. I don't know if future radio work is or podcast work, I guess. I don't know who listens to the radio anymore, but podcast work is not my future because I think the giggles would come quickly.
It's totally fine to giggle. I think you would endear yourself to your audience. I think people like giggling, so at least I hope so, because I'm a
I
giggler
hope
myself.
so
So,
too. I'm really hoping we don't laugh too much during this because half of our meetings involve lots of laughter. Yes.
totally welcomed and appreciated, and you will find like-minded gigglers here at the Health Equity Jam session. So very good. So thanks for playing, everybody. We're gonna now transition to our more formal way that we go about introducing our speakers, and I'll invite them maybe to even start bringing up their slides as I share this. But so just by background, so Dr. Vanya Jones, as you heard earlier from Dr. Cooper, is an associate professor at our School of Public Health at Hopkins in the Department of Health, Behavior, and Society. She is the inaugural Assistant Dean of Community Engaged Research at the Bloomberg School of Public Health, and she's also the Associate Director of the Johns Hopkins Urban Health Institute. She's been involved in a lot of different local government and community organizations, including the Baltimore City Health Department's Local Health Improvement Coalition, where she served as president of the board of Banner Neighborhoods Community Corporation. And she's also a member of the School of Public Health IRB, the Institutional Review Board. And she's a member of the Child Injury Prevention Network and a core faculty member of the Center for Gun Violence Solutions, as well as the Johns Hopkins Center for Injury Research and Policy. So in addition to her community engaged research and the awards that she's won through that, she's also an award-winning teacher and educational mentor. She further is a board member of the Alpha chapter of the Delta Omega Public Health Honor Society at Hopkins. So welcome, Dr. Jones. And then Dr. Muqueeth, Dr. Sadiya Muqueeth is, as you heard a bit earlier, is an assistant scientist in health policy and management at the Bloomberg School of Public Health, and also is detailed at the Baltimore City Health Department as the Chief Health Policy and Strategy Officer. And she serves as Associate Director at the Urban Health Institute here at Hopkins. Dr. Muqueeth fortifies public health systems to better serve communities by improving policies, fostering strategic coherence, and advocating for health in all policies as a key approach. She plays a critical role in developing the Baltimore City Health Department's health policy agenda and advances their Public Health 3.0 initiative. She's a public health practitioner and has expertise in health equity, community engagement, and policy, and has prior experience in the federal government, local governments, as well as the nonprofit and healthcare sectors, and also in philanthropy. And so in her role at the Urban Health Institute, she supports strategic consultation grants between academia and local government. As far as wanted to highlight a couple things, including in one of Dr. Muqueeth's honors, where in 2021 she was named as the Dave Beaumont Foundation's 40 Under 40 in Public Health group. So welcome, Dr. Muqueeth, and I look forward to hearing from you and Dr. Jones.
So just want to make sure you're seeing the right slides.
We are.
Not a notes, fantastic. We decided that we would do what we do in the way we lead our work together, which is talk a lot and sort of process ideas and thoughts as a team. So the goal that we work together to support goal 2 for the Urban Health Institute. And Dr. Cooper, I'm sorry to say I don't have the exact words. I saw Brandon Bowden on here as well. The exact words committed to memory, but the take-home message of what goal 2 is supporting Hopkins working with government entities in Baltimore. So we call them government or quasi-government. And people go, what are quasi-government entities? Everyone asks me that. Quasi-government entities are those groups that support a government feature. My favorite example, modern day, because we have a project funded for this, is Barks. So Barks is the nonprofit animal donation shelter in Baltimore City. Barks also serves as the animal impoundment lot for the city. So if an animal is picked up, they go to Barks, thus serving a key function in the city as a part of the government. So that is a quasi-government entity. And I had the pleasure of starting as the associate director, the single associate director with Goal 2 under Dr. Cooper's leadership, and quickly realized that I understand being a faculty member. I understand the role of wanting to partner and wanting to work with different groups. Thus, the inaugural assistant dean for community engaged research. What I didn't understand and learned very quickly how much I don't understand is government and the processes of government. Even though I've partnered with health departments and I've worked with city schools and I've worked with other groups, there is the ins of being on the inside that you don't understand. And so Sadiya and I had met many times, and I asked if she would join me, and she said yes. Yay me, yay UHI. And so I want to say, Sadiya, can you tell us a little bit about partnerships between academic institutions and government from your perspective as a person who is now helping me to lead partnership work?
Yeah. All right. So hi, everyone. Like I said, I get to sit most of my time, the majority of my time, within the context of a local health department, which means I get to see the ins and outs of the machine that a lot of people kind of see as sort of a gray space, right? We know deep public health work happens there. And we also know that in cities, you have lots of different institutions, including anchor institutions that serve a specific geographic area. Johns Hopkins University is one of the anchor institutions of Baltimore City. And so when this was formed, I mean, I had heard about the Urban Health Institute when I was a baby undergrad at Hopkins. And so when this was formed, it was really thinking about like, how do we connect the pieces of being this anchor institution and really ensuring that the folks within our city, the residents, are served and to the best of their health. And there's one way in which those anchor institutions partner is through academic partnerships, right? So we have academic partnerships and academic and government partnerships. They'll come together to usually solve a very specific kind of narrowly defined issue. And it often ends up being in the space of research. Now, we can say that it's research, like I'm casting a big tent on research, right? Research can show up in formative research. It can show up in community-based research. It can show up in analysis of existing data. It can show up as program evaluation. So the many ways in which this information that we have, both within government, within community, and within sort of academia and within the academy, really comes together to ensure that we are serving the residents of the city at the end of the day. And often, because anchor institutions can be often seen as either like a school of medicine or a school of public health, right? They're often partnering with the hub within a city, and that's the health department. When you think about a local health department, I want you to think about which entity is the leading health authority for that jurisdiction. That is your local health department. Local health departments have varying capacities across this nation. We need to be very intentional about what that looks like, how that might show up when you may go back home or move to another area to work, right? How your local health department partners there. But it is still a hub. And if it is not necessarily the entity that can facilitate sort of the work happening, it might offer the connection or the support or the facilitation to get to the other organizations that have the work that we want to do. Local health departments are often also the people who are feeding information up to either the county executive or the city executive, whether it's a mayor or otherwise, right? And so they're often the ones who are potentially guiding the health portfolio and the health priorities of that city. And so in that space, an academic center has a really great opportunity to infuse information so that we have science informing the lives of people to improve the quality of life. So I'll hand it back over to you for the next slide, please. Could you talk a little bit about the possibilities for improving what we know?
Yeah, so one of the things that Sadiya pointed out is there are ways that the partnerships of anchor institutions like universities often work. So they work with data and specifically around research, and for a school of public health or a school of medicine, often with the health department. but that leaves us with so many groups. And I think that one of the things that I've learned in this role, like in Baltimore, for example, is that there are so many other combinations of experts in policy and science, even that focus on health. If you just want to focus on health, one of my favorite stories is meeting with the housing commissioner, Alice Kennedy, who told us that in Baltimore City, when there is a shooting, the Housing Commission has a group that goes out to communities to look at what sort of physically is in this space that can help mitigate violence, and what are some of the sort of housing initiatives that are in this space. And so they have data around whether that when there's a shooting in Baltimore, what their sort of role could be in that space. And they also have initiatives around that. I did not think of housing and violence, like the Housing Commission and violence, being a partnership. But because we got to meet with, the housing commissioner, she told us a lot about what was happening in the city around policy of housing and how it actually impacts violence. So I think, when we think about what it means to be, this in the science place, we don't think necessarily what is happening in government and policy. I also want to take a really quick commercial and say, we're talking specifically about government. So big P and little p, right? How big P, like changing of policies, like thinking about Lorraine Dean, who got funding from us to evaluate the guaranteed income pilot project with the mayor's office. So we helped give them money to think about what the evaluation strategy could be. That's big P. If Baltimore implements, a guaranteed income policy project, a guaranteed income policy initiative, that's big P. That's changing, fundamental policy at city. But then there's little p, as we're thinking about, I mentioned barks already. As we think about barks, the reason we have a project thinking about dogs and animals is because dog bites, there's at least one fatal dog bite of a child, and according to the trauma service at Hopkins, at least one admission a month of a serious dog bite injury in pediatrics, right? At least one. And so what do we know, knowing that there's an entity in the city that works with dogs specifically and dog owners and is over the dog policy? So thinking broadly about policy and science allows us to do some more real-time relevance. We're able to look at data. We're able to try and think about what are things that we might want to enact that can be quicker than your R01 getting to year 5 of results, right? And so if what we're thinking in doing this real-time relevance work is figuring out how we positively strengthen relationships. I think we can all talk about the challenges between academia, the historic challenges between academia and all kinds of community issues. We are now in a time where we have an opportunity to change that narrative. It is not easy. It is not going to take one small project to do that. It is going to take work and intention around relationships and thinking about what does that work mean. What we've discovered in the work that we do together, because you're giving me this look, is that work means allowing the people who aren't in academia to guide the relationship. One of my favorite refrains, and we're going to talk a little bit about how we work, is Sadiya, when we meet with possible teams, is Sadiya saying, so tell me directly how this benefits the city. I need you to say those words, right? Yes. She actually said, like, over and over again. And I know when someone's reaching out to me, I'm like, when we meet, you're going to have to tell us exactly how this benefits the city. And so what that means is, if we are thinking broadly about expanding the partnerships, we are thinking about what does it mean for different entities across Johns Hopkins. So as a reminder, the Urban Health Institute is a university-wide center. So different entities across Hopkins. And what does that mean to engage with Baltimore City? So with that in mind, the strategic consultant grants were born. Why don't you talk a little bit about, I've brought up your statement that I promise you, if you meet with us, it's going to come up. Sadiya is going to ask you, how does this benefit the city? Can you talk a little bit about your perspective of city needs and government needs and academic needs, given your unique position?
Yes. So I have academic training, but I live in the world of practice, right? When I talk about myself, I think of myself as a public health practitioner. And when we think about public health practice, my orientation is towards not necessarily answering a research question. It's around what is, like, when we think about sort of the arc of a logic model, and I'm hinting at this for the future, what is it that we are actually solving for in a person's life, right? This public health is about one person, many people's lives day in and day out. And so I feel a personal responsibility, I think, towards that, which is why I often ask the question, what is this research going to do for the neighborhoods, the city, and people? Like at the end of the day, the first word in public health is people. We cannot have health without having people. And so how are we really working towards that? And so that's sort of the context of why there's that orientation towards people. Okay, now where does the pathway, like in that pathway of improving a person's life, where does research or the sort of the world of the academy fit into that? And how are we doing this on this scale? So the strategic consultations grants, as you may be aware because you've visited the UHI site before, which I would encourage you all to do. There's a QR code at the end. Is a grant mechanism. It's conducted on a rolling basis, and it's roughly about $10,000. Timelines are about 6 months, although they can be extended. And this is really around solving a problem or for a specific need that can help government address and improve people's health, right? So these projects are obviously time limited, but in that time limited space, they're quite flexible, right? We're willing to work with you, and we'll talk a little bit more about that. The focus there is to support. Now, one might think, oh, okay, so you're giving dollars to government. Not necessarily. This is really about supporting that relationship between government and the academy. And the focus is about investing dollars into faculty so that they have the bandwidth, the sort of the agency to work with your government agencies. And this is specific to Baltimore City because, again, Hopkins is an anchor institution within our city. That's it.
So this is really funny because behind us is a really rudimentary drawing of this graph. Behind us, which has been sitting on my board for months, is a rudimentary drawing of what we think is sort of the conceptual model of the strategic consultant grant. So when you apply, or when one applies, the commercial is for you to apply if you're at Hopkins, but when one applies for these funds, we are starting with this idea that we want this partnership between academic and local government entities, right? Hopkins faculty, and this is just for Hopkins faculty, while students can work on projects and be paid, the actual relationship is between the faculty and the government person. So the green boxes are what we do when we spend time helping someone develop an application. So we have the groups, we're gonna walk through this individually, have the groups work on understanding that these are the things that they're working through in order to submit the application. There's a lot of things that happen before the actual application gets submitted to the portal, which is the orange box application. We think about how the application of scientific knowledge is in an applied setting. That is written down in the application. That is what we're moving towards. And for us, on the other side, when people do their annual reports or their 6 month or their midterm reports, Natalie, I'm looking at you because you remind me about the reporting process. There's meaning. We want to understand what is the definition of meaningful partnerships in these groups. What are the development of tools and strategies that in those partnerships and tools and strategies that help us build a healthier Baltimore? And then this under the line, so that line that's going across is kind of a timeline, but underneath this technical assistance from academic and practice team, otherwise known as Vanya and Sadiya, these are the things that we spend a lot of time doing. So, and we're going to talk through each of these. So let's just get started, right? So I wanted to show you, we have intentionally thought about how this works, right? And for us, the funding, obviously funding is important. Everyone tells us money is important. I want to point out that, $10,000 is modest. It's not a lot of money. But not a lot of money is often what you need in order to get the conversation started, right? So while $10,000 is not a big pot, one of the other things that's really interesting about this mechanism is its flexibility. We have the ability, usually within a funding mechanism like this, $10,000 is about 6 months, as Sadiya mentioned. That's often what people apply for. Many times, almost I want to say almost 90% of all of our applications.
I back that.
She knows where I'm going with this because it's true. Ask for a no-cost extension, right? So I don't know how many of you are in academic settings and how many of you are like, yeah, we didn't spend the money or get to do what we said we were going to do in the timeline we said we were going to do it. One of the things that I think is lovely about this in particular mechanism is the request for a no-cost extension is relatively easy, and that's important if you think about our first sort of big aim, which is building strong partnerships. If we are adhering you to rigid timelines that you wrote, it's really important for us to say, if your team has decided this does not work this way, come to us. Let's have a conversation. Let's see how we can be as flexible as we can be, which allows us to get to number 3, the bullet point 3 on here, which is this is not a one-time mechanism. Now, yes, there is the opportunity to apply for more than one funding cycle. But the understanding is that any future funds will be a different goal and aim, right? So if we think about building the relationship of doing a project, you have to complete one task. You have to have your success in the completion of one funding cycle in order to say, we're going to build on this through X, right? And so we have the opportunity to do that. We won't just cut you off because we know sometimes the relationships can be fragile, which allows us to come back and forth with groups for them to clarify their scope of work. I think one of the most challenging things that we see with the no cost extension need and the need for more money is we know how, as an academic, and I think this is where Sadiya really helps me think through this, as an academic, I know what that looks like from a research timeline. As a person who's partnering with a government entity, I don't always know what that looks like, say, in a, I don't know, election cycle. Right? Like we had an election cycle that happened was it last year? When was the primary for Brandon Scott? We actually had people at the city say to us, we're not applying for anything until we know what happens with the primaries. Right? That's important to know. And that's important to know how things sort of run in the city.
Yeah. And that there are seasons, right? Like, so it's budget season and everybody is focused on ensuring like maybe city budget requests are going in, right? And so I think often when we think about like community-based participatory research or community agency in research, we think often about community-based organizations or community coalitions, but understanding that government works differently, has different timelines, thinking about like another entity, it is still a system, but it's a system with its own sort of, web that it needs to weave in order to be able to get to that partnership. And so I think having clarity around that's really key in this process.
And that leads us to this last point, which is what we just talked through helps us to build understanding of costs and process for each. We can talk about the health department has their own. We can talk about housing has a completely different one. We can talk about city schools. I don't know if anyone has ever worked with a city school district. I do work in Baltimore City Public Schools. It has its own. And if you want to combine the 3, or at least the 2, because we do a lot of people say we're doing work with the health department in city schools, and we're like, so who's the prime here? Because those are 2 very different organizations. And so we've learned in managing this is that you have to understand costs and processes look different across the institutions. And if different faculty aren't aware of that, then we have to ask those questions as the people who are trying to support these relationships. So why don't you tell us a little bit about, I feel like I've been talking a little bit about administrative activities.
So funding, we're really clarifying the scope. We're trying to understand what we're doing, how we're doing it. Funding always helps you clarify scope because what it does, it allows you to put allotment of time and effort towards an actual service, right? So what are we doing? But in order to move that process forward, we need to have the administrative activities. As someone who always shies away from the admin side, I'd like to do the thinking side, but the administrative activities, they're extremely important. We have a lot of support around that. Shout out to some of the folks on the call here today for their support. And then we have a wonderful team member, Ashley, as well, who works with us on this. And this is a team process, right? Like this is not going to happen with Vanya and Sadiya alone, for sure. It takes Poor Ashley has to ring me a couple of times before I get organized enough to respond sometimes. So, but it's really about making sure that that happens, and then that the payment mechanisms are coming in. So this is everything from like top of the pipeline, right? So when the application gets submitted, how it weaves through UHI's process and how we kind of review it, accept it, or say, hey, we need to work on it. Then it goes through the sort of service delivery portion and payment, and then making sure that then the deliverables are actually coming back to us. As a public health practitioner, I don't know how many folks here want to do research and want to do practice. It does not matter. You need to understand administrative processes. I feel like the one thing that I did not know that I would have to sign up for, and I'm looking at Dr. Cooper right now on the Hollywood Squares of saying, like, I'm sure she knows as a leader in the field that this is such an important part of just getting things moving. So anything to...
Yeah, and so while Sadiya talked a lot about, our processes, these are the mirroring of the processes that the teams that we fund also go through.
Yes.
Right. And so we've had teams where if it is a research project that's gone 6 months, now mind you, right? 6 months is the timeline they allotted for. They went 6 months to get an IRB, or they went 6 months to get an MO, a data use agreement that was key to their project because the processes are hard. I put in my bio often that I serve on the IRB, in part because this is where people are like, we don't really talk to you. We don't want to talk to you. You make our lives terrible. You're the people who make it. Truth be told, our job is to try and be supportive of how we do research. There's a reason we exist. But the other part of that is I'm able to bring connections and knowledge about some of these administrative things that I know have hung up different groups, particularly at the Hopkins side. Now, I can't speak to the Board of Estimates and how that happens in the city, which is a whole different thing. If you've ever worked with the Board of Estimates in Baltimore City and getting a budget through, it's a different thing. It's just a different thing, right? And so we're trying to figure out how we help the teams that we fund get through this. But it's helpful that as a team, we understand those structures and those strategies, which leads us to timeframes. That's team time. We've had different members of teams have reached out to us and said, I haven't met with my team at all. My teammate, like the government person, will call us and we're like, well, let's just have a conversation. Like, let's figure out, if the project is moving on time, does the funding time need to change? And we also are fully aware, I mentioned elected officials. We also have changes in leadership, right? Like outside of time, like things change over time. The focus of a group or an entity or a policy change might happen while someone's midstream in a project. And we have to be able to understand that that's going to happen. And when that happens, that it doesn't mean that the relationship can't still grow, right? It might mean that the project and the deliverables have to pivot. But the only way we know this is to have these conversations, which leads us to connections.
Okay. So we mentioned earlier that these are modest investments, right? These are not sort of a $500,000 full-on research project over, 3 to 5 years, et cetera. This is really about sort of potentially either establishing a process and making sure that people know each other, right? All of these projects are built on relationships. Relationships make change happen. And in order to do that, sometimes it's about the small building blocks that are put forward, right? And so initiatives like this that are able to invest sort of small dollar or modest dollar amounts into partnerships actually facilitate building that network. You get to understand the system a little bit better as a grantee. You understand both the needs, but then also the structures, right? Structure is extremely important. Dr. Jones just mentioned the concept of the BOE, right? And some of you may not have heard of that. That's the Board of Estimates. Like, it is a process that cities actually have to go through in order to approve the spending of money, right? most people don't go in and log into your local government's television portal and watch how money is approved. That is not an exciting way to spend your time.
It is
But
not.
it is an important aspect of government function, right? And so that also allows you to say, okay, these are the pathways forward. These are potential, pain points that maybe we would need to address. And these are the things that we need to think about as we look at the future challenges that we want to work on. So this is really hopefully sort of serving as a launch pad towards that end.
Yeah, and I think the other thing is we haven't said this. We're about to move into how we actually work, which is Sadiya and I meet a lot.
Yeah.
We have standing weekly meetings where we review projects that are funded. We also talk about the projects that people have reached out to us with interest, again, with this eye towards our goal of deepening relationships and helping to support a healthier Baltimore. And so when we come together, there's a couple of things that we do really concretely. Do you want to start? Do you want to start the list, and then
sure.
I wind it up.
This is the overview of the
Yes.
list. This is what we're doing in terms of providing the technical assistance.
Let's see what.
So last night I went to a fantastic dinner that the Planetary Health Center sort of hosted, and there I was, they were talking about, we had Black Yield Institute speaking there, as well as South Baltimore Community Land Trust, members from both organizations. But there was a great time and space for me to be like, hey, folks, are you aware of the Urban Health Institute's opportunities here? To some of our Hopkins colleagues who were also presenting. And so it's sort of like when and where and how are we promoting this work, how we're thinking about it, because it's not just, when we think of Urban Health Institute, it is not solely in the space of the School of Public Health, Medicine, or Nursing. It is really broader across the whole of the university. And we know that whether we're talking about structural racism, and that might be a relationship with anthropology, talking about environmental engineering, that might be a relationship that we're working on with like DPW, all of those things. DPW is the Department of Public Works. I got acronym soup. And so like, how do we ensure that we are facilitating and bringing awareness to that? So that's sort of part of that role. And then the second,
can I tell him that she texted me last night? I'm just going to tell this. She didn't know I was going to say this. She texted me last night. It was like, I'm at this thing. I'm going to talk about UHI and the strategic consultant grants. And my only response was yes, exclamation point, exclamation point, exclamation point. Like, seriously, like you want to have the relationship seamless.
Right. And some folks were like, oh, I actually already have a grant, but it's with the community side and not with the government side. So great, fantastic. While someone else was like, I had no idea this opportunity existed. So I think there's a lot of promotion and awareness building that we do. And then also sort of matchmaking, right? Like Dr. Jones knows faculty and this fantastic, right? And then I know government. And so together we are your matchmaking, speed dating, whatever you want to call it, of government and academia.
For grants.
For grants.
Yeah, that's nothing else.
Nothing else.
Just the grants.
Just the grants. Sorry. Just for so that we can facilitate that kind of partnership where we see connections building, right? And then also, go ahead.
Yeah, no, sorry. I feel like I'm jumping in a lot here. But I also want to point out, when faculty come to us, we've had more than one faculty member come to us and say, well, I have this project and I have these research assistants who need to get paid. And it's a really interesting project. And I just need a government, like, I have this data and I just need the government to sign on. And that's when Sadiya says, how does this benefit the government? Or how does it benefit Baltimore? And oftentimes the faculty member goes, oh, so I need to go back and think about like the relationship portion. Yes, that's where, like, if we say the matchmaking is real, the matchmaking is real.
Yes, absolutely. And then coaching and the application. So for one of the things that we did, the asthma team at the health department was thinking through like, oh, we'd like to think about conducting a needs assessment. How might we do this? And so saying, where might be an opportunity, who might be the right people. So working with them to say, hey, here's the process, here's the understanding of the process. You already have a coalition and you have members of our faculty on that coalition. Why not talk to them about it, right? And so building from there and sort of really navigating, how would you recommend applying for, this much? Like their scope was I think 2 years worth of a scope in a 6-month initiative.
No,
we're like,
that's not gonna
okay,
happen.
let's think about it. Let's really scale it and par it down. So really thinking intentionally through that process as well.
So we also spend time troubleshooting again. I feel like our biggest sort of time spent is being fully aware that things will and do go wrong or change, right? Like best laid plans have to change. We have no projects that haven't had to change. We're okay with that. We understand that. And so
can you guys give us a few specific examples of things? I think that would help. Yeah.
Of things that come up and change.
Yeah.
I think for one of the challenges is we had a project I was looking at getting 311 data. And then once they got the 311 data set, they realized that A, it was both incomplete in what they were looking for, and B, the way it was set up, they actually couldn't translate it to the data system that they were going to use it in. So they wrote this grant saying that all we have to do is get this data, then we can run the analysis, and then discovered once they got the data, they couldn't do anything that they said they were going to do in that project. And then they came back and was just like, so can we rethink how this works, right? Both the government partner and the faculty member was like, one of the things we're going to have to do is go back in and give them some guidance on the variable content that's in the 311 data mechanism that they use in order to make it a system that can be analyzed. Mm-hmm. So we gave them an extension on their grant. We also gave them an opportunity. We met a couple times. We talked a little bit about trying to match with some data folks, right? And so that particular project has changed in its scope from being able to do this one round of data analysis to, in fact, being able to say, if we want to do data analysis with this particular group, they're going to have to change the way the data system is set up. It has to happen. Is that so? I think that's one where I'm not calling anybody out.
Okay. Yeah, I know you don't want to specifically name
right
that, but I just think it might help folks, make it sort of concrete for people what you mean.
And these are, when we say things come up, right? Like if we're working with government, imagine that you're working on something related to overdose. This is sort of not something that we're working on right now, right? Imagine that you're related to overdose, right? And we see a significant change in the drug supply of the city, right? So how does that impact the work that you're doing, right? This is sort of real life. We're working in an applied setting. And I'm using that not as a sort of example to what we've experienced necessarily, but as an example of something that could happen. And so we have to be able to, as public health researchers and practitioners, be able to understand that the landscape changes, as Dr. Jones had mentioned, and that we have to be able to pivot accordingly.
Yeah, another one, as I was trying to think what we could talk about that wouldn't call anybody out. There was so Sadiya mentioned a coalition. The leader of the coalition changed, but the grant was with a faculty member and a member of the coalition. And when the new coalition leader came in, they were like, yeah, we just need to pause everything and get brought back up to speed. And we don't know if this is going to be the focus. Now, we've already funded this project and they were already making progress. And now there's a new leader that's saying, I'm not so sure this is the direction we want to go. And so what do you do, right? Do you abandon them? Do you say, okay, let's just all stop? Well, one of the things that we were able to do was work with that particular team to sort of say, if you ended today with this phase of the project, what do you have, right? And if you were to end today and think about bringing this person up to speed, what are all of our options? And so we met with them to think through all of our options. They were able to continue on, but that was a real potential threat of the additional project and this idea that this group had come up with. So yeah, so real things happen, right? And our check-ins are really helpful. It's funny. We ask people to we used to ask people to write down, like do a written report. And submit the written report. And so from our conversations, we now do an oral check-in. So big shout out to Ashley, who we do an oral check-in. We meet with the team. We meet with a faculty member. We tell them they can invite the team partner, but we know the money is to the faculty member. The team partner often comes, the government partner often comes, and we have them talk through the questions. We just talk about them. It's a conversation, right? There's no one put on the spot. Ashley takes notes. And then at the end, we say, we're going to have Ashley we've asked you all the questions on our evaluation form. We're going to have Ashley put what we talked about in the answers of the form, and we're going to send that to you. And you fill in the gaps, right? If there are things that we missed, if there are things you didn't say, you fill in the gaps. And we've discovered we've gotten far more complete midterm and final term reports by doing it that way, because everyone gets to hear what's happening. We also get to hear more nuanced conversation about, what's going wrong or what's going right, like what was unexpectedly going well that they didn't intend. And so the last point on here is, we constantly are talking about how does the information or the product that you use go back to Baltimore? What is the mechanism? Granted, lots of people get publications on the faculty side. Does it go in a report? Does it go on someone's website? How does it live on? What's the next phase? And so there's always conversation about that. We're actually looking through all of our funded projects right now to understand what the dissemination. We don't have those for you because we're working on it.
And I will say one thing, the dissemination part. This is extremely important. People who are reading journal articles may not be reading other forms of published material. And folks who are reading, let's say, Maryland Matters may not be reading, which is a newsletter. It has policy information, very focused on policy and at Maryland, may not be reading journal articles. And so I know that I bring this of just like, are you disseminating to the audience that you are used to because you live in that space, or are you disseminating to the audience where change happens, and being very intentional about that?
And so I know we're running a little long in time, so I just want to point out our whole point is to try and create what we're identifying as reliable, mutually supportive partnerships that align work processes, that acknowledging that the processes are different, but we can figure out a way, that different processes can speak through the work that needs to happen to make a healthier Baltimore, with the creation of new resources and new information. Oftentimes when we're looking at something different, it gives us an opportunity to have aha moments that we wouldn't have had if we didn't take time to look at them in a partnership. And it allows us to think about systems changes across the city. I go back to the housing work, which has been put on hold because we're getting a new housing commissioner. So things that happen, we're getting a new housing commissioner in Baltimore. So now the work that we're doing with housing might have to pivot, but there's a lot of work that can happen there. And the new application of existing information. I talked about the 311 work because I think there's a lot of interesting information in 311. These are where people in the city are requesting services, and allows us, to have a conversation about what does it mean for the services in different contexts across the city. As Sadiya mentioned, we had, we're at our last slide. If you are at Hopkins in any capacity as a faculty member, please click on the QR code. Thank you, Ashley, for creating this for us. Ashley's on the other side of my door and I can hear her coughing, which I needed to give her another shout out. Please go to the website, learn a little bit about the strategic consultant grants. This is a picture of the cover page of the application process. And if you have questions, please contact us. You can email UHI. How to contact UHI is there. But we want to have a conversation with you about how you can help make Baltimore safer and healthier. I'm going to stop sharing because I think this is where we open it up for discussions.
Yes. Well, thank you. Thank you both. That was great. Really, I'm sure folks have some questions. I jotted down a few that I'm hoping you all can maybe tackle as people start to think of questions that they may have. It was a really great overview of your work. excuse me, with UHI. I was struck by what you shared about how different government agencies may have. Obviously, they've got different priorities and things as you discussed. Have you all ever come across there being even almost like competition or turf wars between agencies that investigators need to be or academics need to be aware of when they may approach, working with one group that also excuse me, has some sort of relationship or some sticky history, with another group. I'm just curious as to whether that sort of thing has come up.
Yeah, so I think the closest thing that has come up for us in probably within our time recently is city schools and the health department.
Okay.
If you think about particularly school-based health services, or you think about some of the sort of the youth mental health work, right? Like the health department has its own space in that and appropriately leads a lot of work in that. So do city schools when you're talking about young people. And
Yeah.
so it's an interesting, my experience is what angle, like we have to ask what angle are you coming from in this space? Especially when a faculty member approaches us. I will say, if you come to us and say, we want to work with youth, we're going to be like, so what you doing? Right? Like, are you talking parks and it's rec and parks.
It's rec and
Rec
parks,
and
not
parks. Rec and parks, people. Rec and parks.
Not parks and rec.
If you or are you talking about city schools? Are you talking you have to hone in the city when you say I want to work with young people, because
Okay.
the angle that you're coming at, that's if we're going to get ourselves into a sticky situation where people feel like they have turf wars that are going to happen, there's a few places, and I feel like one of the biggest is young people.
Yeah. I think that's a really great point, and sort of the way that you think about this. So org charts. Understand, as you're looking to work with government, understand the org chart within the organization or agency, and try to understand the org chart across the whole of the sort of city agency landscape, right?
So that's the part that she does, that second part. This is where her knowledge really helps out, that across the landscape.
So as we think about that, right? So we have a fantastic project with Dr. Eli Mew, who does food systems research, and Assistant Commissioner Alice Fong within the health department. They're looking to look at the landscape of food programming within the context of health. Now, as we're thinking about that, we cannot look at that in a silo. So this isn't necessarily sticky, but this is relational, right? Everything is relational. And every place has history. Like, we work at Hopkins. Hopkins has history, right? Researchers have history.
Yeah.
And so as we think about that, right? Like understanding what is the context of like the portfolio of services within the health department, but what does that look like in the broader food policy landscape and food programming landscape within the city? And so that's sort of an intentional part of it. Now, this group that came together with Dr. Mew and Assistant Commissioner Hong's work was actually phenomenal, because when they were bringing people together around sort of building a strategy for the health department. But when the snap cuts happened, that same group that was mobilized, that meeting got turned into, all right, let's go. What are we doing around SNAP, right? How are we getting information around food out there? How are we so when I talk about building relationships and partnerships, you don't necessarily know how those partnerships are going to amplify other work, how they're going to be mobilized in other ways, right? I think that's such a powerful example of what human to human connection does, and what the academy actually, in a sort of a small way of bringing together folks to think intentionally about something, actually facilitated in the broader spectrum. So that's sort of one sort of maybe not like sticky relationship, but like a positive relationship building concept.
Yeah, I think this answers Dr. Cooper, your question earlier about give us examples. Like, here's an example of how it worked positively, right? Like they were already working in food system space. And
it wasn't an academic partner, right? It was just that group within the health department that the Assistant Commissioner Huang was able to bring together, that like was able to then pivot, which is fantastic, without it having to rely, and like Dr. Mew was able to provide some insights, of course, but it's sort of like, again, everything is relational. Public health is relational. So being very intentional about that's important.
And we wouldn't know that without like the, sort of the report back of what's happening with the groups that we fund, right? So
Yeah. No, thank you for that. So I wanted to open it up to others. If you want to raise your hand and unmute and ask your question, or you can place it in the chat. I may, if I could come to Dr. Cooper's question in the chat. She may
Yeah,
not be.
I mean, yeah, I was just wondering because we've had speakers this fall. Our whole team has been on policy, right? And on academics engaging with policymakers and different ways, just basic ideas about this that a lot of academics don't know anything about. And then even studies about like what policymakers actually want or need from academics. And I think you guys are kind of making a case for it, even when an academic kind of has learned sort of the ABCs of advocacy with policymakers or doing policy related work, research. That there's still all this other stuff that they don't know that they need to navigate. And so I'm just wondering, well, first of all, are you aware of similar programs at other academic institutions to this one? And then are you also concerned that I think one of the reasons you guys are not totally overwhelmed yet is because not everybody knows about you. But if more people find out about this, are you actually concerned that maybe there's going to be so much demand that what are you seeing in terms of demand? Is I guess what I wanted to hear about.
yeah, so your first question, we've done a landscape analysis. We've had students look across projects. We have yet to find one specific to the type of project that we're doing. Like there's small grants funding across the country around community organizations and community partnerships, but this one that's very intentional with relationship building for government entities. I've yet to have, sort of in the landscape that we've looked, found something that funds things this way. So I think we're very novel in this approach. Your second question. So yeah, are we right now? We're not worried, of the embarrassment of riches of people reaching out to us, with the caveat that part of the reason we're not worried is because when people reach out to us, the meeting around what needs to happen usually slows down that application a lot.
Yes.
Because once we describe what they have to do, like you need a letter. I don't know if anyone on this call has gotten a letter of support from a government entity, and without a relationship and having to build the relationship, that in and of itself could be you're not going to get funded this year, right? That in and of itself means that you didn't do the initial legwork in order to say that this is a partnership that's going to, be fruitful to a government or quasi-government entity. So are we worried about that? Not yet, because we think the process in and of itself right now helps to build in a timeline. I do think as relationships build, we might see that being more of a threat. I'm not quite so worried about it yet. Are you?
I'm not worried about it yet. I do think that pause of saying, okay, let's wait and discuss and think, and what does intentional, like there's a lot of I would say the theme across all of this work, right, across the whole of the logic model or the DAG is rather intentionality, right? Intentionality in how we work. And if the how is that important, that first meeting where we're like, how well do you know your partner? What is the engagement like? So we had one example where someone was like, I believe the government should do X over and over and over again. And they had been meeting with government partners left and right all over, which is great because you're building energy around them. But that doesn't necessarily mean that the project is conceptualized in a way that was responsive to government, intentional around government, et cetera. And so while that created awareness building around the need for that project, it didn't create the right energy to actually light the fire to get that project going. And so I think we just have to be very, when we pause to think about intentionality, you really put a lot of projects on hold, honestly.
Yeah. We have a long list of like potential projects because someone reached out to us, met with us, had a conversation, and both government and faculty, and then never come back because
It's a lot of work. It's a
It's a
lot of,
lot of work. It is. It is.
but when you hear
Yeah.
this, it makes you understand more about why it takes so long to see change,
Yeah.
like the change that we all want, because it is a lot of work. What do you think would make it easier? I mean, I don't want to monopolize you guys if other people have time, but I
Oh, it's
have.
a great question. What do we think would make it
What do you
easy?
think would make it easier for people to be able to do this? Because I'm guessing people don't come back because they're like they've got other pressing priorities and nobody's really incentivizing them to do this, right?
Yeah.
Yeah, I would think, and I just wanted, that was a question that I had that I thought might be helpful for some of the folks on this call today, like along the same lines, like how do you suggest someone just get started? Like someone, what is the best, what's the first thing to do if you're an academic and you want to venture into this space?
Well, if you have an idea, and so what we do matchmaking. I mean, I think having,
Okay.
someone who's embedded in government understands both the health department, the mayor's office, lots of different the quasi, right, right.
Many organizational
If
influence.
there's the person that was just referred to that came to us who had been meeting with people, we were like, great. Which of those is your primary partner that can help you with, sort of strategizing of making what you're interested move across the line? And like the onus is then back on, if you've met with all these people, the onus is then back on you. We've also met with like the potential teams, right? And when we discuss what we're doing, what we're trying to do, one or both might be like, yeah, this isn't really what we're interested in, right? Um, I think so while it's not the most cumbersome of applications, it is an application that requires thoughtfulness in the areas that are important, which is how does this benefit the city and how do the partners come together? And I feel like that is unique in an academic setting. We don't always talk about sort of the shared relationship needs. I think it's also so that's one, right? Like come to us thinking with an understanding that we're going to ask you about shared partnership. I think the other is um, I think translational researchers do this better, but what are you going to need in order to get the information that you think is important to the people, like in a language that the people that you're working with can use, which is that second part of dissemination. And I think people actually struggle with in academia, at least my experience in meeting with different groups, struggle to be able to say that. Right. And so this is where the different languages between academia and policymakers or, sort of government, employees in the relationship or in the conversation is because they're talking past each other.
Yeah.
One thing I'll add to that in terms of what will make things easy, maybe not, I don't know if the word is easier, but it's really sort of like, I don't know if there's one sort of central place that where we're like, these are all the ways our institution is partnering with Baltimore City as a like.
Oh, that's just
hard.
That's just hard.
That's just hard to do. But I think that also said, like, there are so many ways that sort of shows up, right? Whether it's sort of center by center or by the organization at large, our sort of policy landscape, et cetera. So I think there's a lot of different things. I think awareness building, I think one of the things I will say, and I just want to emphasize this, Urban Health Institute is at the university level, right? We are thinking about things not just sort of, yes, health is an outcome, but health can show up in so many ways. And how we maybe, I think, like reach out to engage our non-traditional health influencers in engineering or
arts,
or history, like whatever it may be. I think there might be opportunity there. So like being intentional, because I would imagine public health, nursing, and med are going to be very keen to be like, oh, this is an opportunity. It clearly aligns. How do we kind of advance? But it might not be something that others think of naturally. So
I see Annie has a question about MPH students in the chat. Would like to work with orgs that serve communities. What should be included as part of reaching out? I'm going to look at you. What do you?
Yeah. So I think one of the things is like understanding when are you reaching out cold or are you reaching out through an introduction, Annie, right?
Cold.
Um, Cold. Okay. So if reaching out cold, doing some history and seeing it, going and talking, like doing some learning about like, hey, who's talked to this organization before? Is there a professor that I know, professor that I've worked with, or you have I cannot emphasize this enough. Hopkins colleagues are phenomenal resources and like people you can learn and share with, right? Like this is a network that you're going to continue to build upon as your career continues. Um, and I like so like who are the folks who might know this organization? And if you don't know, just saying that up front, saying, hi, I'm a student from Hopkins. This is my area of interest, and I'm reaching out because of this. I'd love an opportunity to learn more. Would you be available to talk? But then, or if you're reaching out to the executive director, they might not have time to talk and being realistic, or someone on your team, right? Always open it up for that. Hey, I would be happy to sort of start learning.
I'm gonna add to that, which is it's particularly for students in Baltimore. If there's a volunteer core for that organization, or if there's
Source.
not just source for here, but even if the organization, if you don't want to go through source, if there's a volunteer core, if there's an employment core, right? Like reach out to them first because they may actually have like, here are the things that we need. I think it's well intentioned to reach out and say, I want to work here. I want to, support this group. But the flip side of that is, do you align with the needs that they actually have at the time? And if you don't, that might be where you're finding challenge. So I would start with the official channels of their HR or their volunteer core service. And then, if that doesn't work, think about when you talk to those people, is there a possibility for relational interview, right? Can you talk to a person who's doing the type of work or the service that you're interested in doing, and see, again, they might have different needs that can be of a volunteer nature or a work nature. But if it's funneled through their official channels, it allows them to see that you're paying attention to how they operate and not, sort of supermaning in and like, not necessarily being mindful of how they operate as an entity. Dr. Evie, you have your hand up. You've had it up for a while.
Yes, please, Dr. Eva.
Yeah, thank you. First of all, this was such a wonderful talk. It actually felt like we were engaged in a conversation with both of you. So I just really appreciate I appreciate you both so much for not only the work that you do, but the way that you articulated so many critical aspects of what it means to bridge policy with research. And as I was listening to you talk, I couldn't help but wonder if, let's say you could be like Marty McFly and go back in time. What would you tell your younger selves about the skills that you would need to have to do this work? And part of the reason I ask is that something that a lot of us who are doing community engaged work grapple with is a lot of it can only be acquired in terms of skills by doing it. And if there are certain things I wish I knew that knew today, or that, yeah, I don't know how else to put it. There are certain things that you
I'm
can
going to channel my inner Dr. Cooper right now and say, can you give us an example? What are you talking about?
Okay, I'll give an example. I'll give an example. So, a lot of my research focuses on community health workers. And when I first finished my PhD, one of the programs I worked with was at the East Baltimore Medical Center. And it was a great opportunity to see CHW interventions in real time and to look at how nurse care managers and others like related to the CHWs who are in the clinic. But the thing that I kind of regret, the thing I did not realize that I would need to know is how to navigate dynamics between multiple partnering entities that have their own agendas. So it was EBMC, it was, two community-based organizations, and it was Hopkins Health System. And I frequently felt overwhelmed, under well, I think everyone felt undervalued and really felt kind of like marginalized even in the process, because despite my level of training, I was really junior
And, I was a young Black woman working in multiple systems for which those qualities are not always valued despite educational attainment. And so I saw a lot of things that were really frustrating to witness, and then it made it difficult to even focus on the work because there are all these competing agendas, priorities, etc. So that's where I'm coming from when I ask that question, because realistically, I don't actually know what I could have learned any differently. But I'm sure there are certain things that maybe I could have learned along the way that might have better equipped me for assuming that type of role. So that's where that question is coming from.
I don't, I also, I think this is a question that is appropriate broadly for everyone who's on the screen and who's done this kind of work. My gut in answering that question for you and having done this work and also sitting in the role that I sit in as a dean, is twofold. The first is, I think your last point, which is, I don't know, each of those opportunities are probably going to be different, right? While there might be some commonalities, the common thing is you. And one of the things that I have learned is to both understand, like what you shared, is there's a sense of who you are in that space, and there's a sense of who you represent. And who you are comes with a history of experiences, opinions, biases, knowledge. And I think professionally being able to understand those, that this is a lifelong lesson for me, is I walk into a room and Vanya Jones, not Dr. Jones or Dean Jones, Vanya shows up, and Vanya has feelings and opinions. Understand what is driving those for you. I really think we don't spend enough time in community as community engaged people, when we do this type of work, that we have to be mindful that we're bringing a lens. Sometimes that lens is the thing that's causing part of the challenge. And I'm not saying that it goes away. I'm saying it's helpful to figure out processes by which you can do that. I do what I lovingly refer to as professional journaling. I know you do too, to a degree. And I think that's helpful when I hear something that strikes me personally as like, whoa, that made me very emotional. I want to understand what was the thing. And then the second part is interrogating who I come as a professional, right? Like when I walk into a space, I've been in many spaces. I tell the story where I get invited, Vanya gets invited someplace, but Dr. Jones shows up because it's now aligned with my work. And the moment that it aligns with my work, the door seemingly closes in my face. Like, oh no, we're not working with Hopkins. We don't want to do that. Like, you just got official on us. We're not doing that. And I'm like, whoa, nothing changed. It's still me. And the answer is no. And so I'm also mindful that I carry the responsibility of this institution when I show up in my official capacity. And that's something that's different, right? And I don't think we spend enough time being mindful that that's who we are. And I feel like when you do that, being able sometimes, at least for me, sometimes being able to see a path forward in some of those turf wars gets clearer because I'm able to understand where the turf war is coming from.
Yeah.
I might take this in a different direction. The thing that I wish I had learned to do earlier was what I will call maybe like a power analysis. Understanding who the stakeholders are in the room is one thing, but understanding the landscape of where the dollars are coming from and where they're going, number one. Number two, where the authority is coming from and going, that is a completely different, right? Like if you do not have regulatory authority, I don't like that matchup of words. That is a different conversation, right? Like you can say, oh, health department, air pollution. And you're like, but we don't have authority over air pollution. That might be another entity, right? And then leadership. So leadership is different from having authority, right? Who's coming up with the idea, who's coming up with pushing an agenda forward, who's advocating, right? That might be the advocates. It's not necessarily maybe the government who's be able to demonstrate leadership in that sort of time and space. So I wish I had learned that or practice that. Maybe I knew it a little bit intuitively just by based on observation, but it was like something that I got much more concrete about as I sort of progressed in my career. And we're never going to get ahead in public health if we don't understand that game and then are able to navigate it.
Did she just illustrate how we're so different, but why we work together, right? Like I came from this very like academic, I'm gonna grow from a leader. And she was like, no, policy. Here's the people who are in power and how power flows and who has power to do what. Like legit, you just saw how we operate in a meeting one-on-one where I'm like, I didn't even think about that way. I don't, okay, got it.
I think that was those are both of those comments. I think in addition to showing, I think illustrating why you all work well together, it also illustrates I think summarizes our deep appreciation for what you've shared today, because I think that both of those perspectives, I was taking a lot of notes about professional journaling and also understanding power structures. And so thank you. Thank you for both of that.
Like she will say to me, that's not the person who makes that decision. Like we're going down the wrong path here. We need to go to this person. I'm like, oh, okay.
No, this has really been wonderful. I think I believe caught the majority of the questions. Certainly, if I know lots of you developed, if you weren't very familiar with the work of the Urban Health Institute, may have developed new interests today. So definitely would encourage you to reach out for some more info. But please join me again in thanking our speakers today, Dr. Jones and Dr. Muqueeth, for such wonderful learnings for all of us. So thank you so much.
Thank you. Thank you for inviting us. And I really hope we did our colleagues at UHI a service and we made you proud. Really hope we made you proud.
Thank you. You sure did. And you showed us that a lot of us academics need a Dr. Muqueeth in our
Yes.
as a partner too.
What? Seriously,
Yeah.
like I learned so much. It's a master lesson whenever we meet. I promise you.
You're very, very kind. Ditto on the same.
Thank you both.
Wonderful.
Yeah. Thanks,
Thank
everybody.
you. And enjoy the holiday next week for those
Yeah.
celebrating. And we'll see you next month for our next jam session.